Hi, welcome back to my channel. So today I just kind of want to talk about some of the proactive things you can do as a patient to keep everybody on the same page, um, especially when you have new doctors or established doctors. I mean, you just want to make sure. I usually keep like a list going on my phone regarding my prescriptions. And especially for me, whenever I go to a new doctor, they want your medical history. I have quite an extensive history to where I keep a list on my computer of dates, procedures, and just so that I can come in and hand them that as well as my prescription. Like I usually have two pieces of paper, as well as my insurance cards, my ID, my medical insurance cards, my ID, and it's my med list and then my medical history list. And on that medical history list, I also put what current afflictions I'm having, current or chronic, as well as part of your medical history, so that they know what all my other doctors know from my point of view. The hospital, okay, if you have to go to the hospital for a procedure and it's scheduled, I would go ahead and bring copies as well. Usually if you're going to the ER, you don't have time to really think, oh, let me print out my medical history and print out my med list. But now, on your phone, you can usually just access it really quick, especially in an emergency situation. I say this because few times that I've been to the hospital on an emergency situation where I had a seizure and had to go to the ER, and they ask you every time they moved me to a different room, they would ask me the same damn questions, and like I would be ready to lose my mind just because of the repetitiveness of it, and I'm just like, why can't the left hand talk to the right? This is a computer generation, right? Like, so just to keep myself from going nuts, I usually like to have copies or at least a running list and note on my phone that I can access like that, so that I can be able to tell them, this is what I'm on, this is what I've had done, these are the operations, these are my doctors. Even that's even more helpful. Obviously, have your doctors on there as well. um, the hospital brings me to another note that make sure you know your prescriptions. Make sure you know their generic counterparts, the real names, what they're prescribed to you for, and really get to know the generic counterparts and the type of medication it is. Is it an anticoagulant? Is it an anti-rejection, like immunosuppressive drug? Because there have been at least two times that I've stayed in certain hospitals, um, well-known hospitals, that they tried to give me a different medication that wasn't even an anti-rejection medication. And I'm like, no, like I know my meds, and I know what you're trying to give me is total, it's not even an immunosuppressant drug. So no, and I didn't take it because that's not, I had the doctor and the nurse come in and like give me my medication. I mean, obviously the doctor didn't come in, but he okayed the pharmacy, to fill my exact prescription, because what they were trying to give was not what I was prescribed. And this has got to happen to a lot of old people, because it's happened to me. And um having an anti-rejection medication uh not given to you, and you're given something else, is a huge deal. So all I can imagine is how many little medications, not even little, but, and it's like not even as, how many other medications by other patients get like just tossed on the wayside because one, they don't know, two, there's nobody there to voice for them, And three, the nurse, like, maybe they're just busy. They don't really have time to. I know they like to double check, and I know it's a CYA situation, but that isn't always the case. So, as a patient, CYA and make sure you know your prescriptions, their generic counterparts, the type of medication it is. This is just very helpful information to have. Um, I can't say enough about educating yourself on whatever you've got going on, especially your medication. Especially going to a facility, be it hospital, rehabilitation. Just make sure that, yeah, everybody is on the same page so that there's no unnecessary confusion that may cause unnecessary and unwanted side effects. Because being in the hospital, like, you're already exposing yourself to infection, among other things. And just be cautious. Thanks. Have a good one. Subscribe, like. Thank you.